So there are several types of ways in which to obtain tumor tissue, and that many of them give different sizes of samples and different amount of tissue that can be tested. And the range basically goes from removing an entire tumor during a surgery or a resection. And in that case, a lot of tumor tissue is obtained, and getting molecular testing on that is usually fairly easy and I think that the results of that are usually very accurate because you have the entire tumor there. And the other end of the spectrum is an FNA, or a fine needle aspirate, in which a very small amount of tumor tissue is obtained. And sometimes, or often, that's enough tissue to obtain molecular testing, but there may be a sampling bias if a tumor has some areas of one histology, such as adenocarcinoma, and some areas with another histology, such as squamous cell carcinoma, or a mixed histology. And so in the cases where a small amount of tissue is obtained, usually because an FNA was done, which is acceptable and is fine for diagnosis, but in those cases that the results come back as squamous cell carcinoma, and I have any concern that there may be other histologies present because of the sample, and if the patient has a very light or never smoking history, I would then want to pursue either diagnostic testing on that small sample, or I would definitely consider going back and obtaining another biopsy if there was a high enough chance in my mind that they had a mutation that was important to know for treatment. So I wouldn't necessarily say a repeat biopsy is necessary in all patients if there's not enough tissue in the initial biopsy, but in patients who have a high enough chance of having a mutation that would be important in terms of deciding on treatment options, I think a biopsy is very often low risk enough that I would want to know the results and would consider sending them for another biopsy if that could be done safely.